Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. Today I will just highlight very briefly on the contraindications to an intravenous thrombolytic drug which is given for a patient who had a stroke. Stroke is a sudden onset of a neurological deficit, like a bolt out of the blue. And the most important is the time when the patient was seen last normal and when this had occurred. So, 4.5 hours after the occurrence of the stroke, within 4.5 hours, if the patient lands in the hospital and some preliminary investigations will be done, and if he is fit enough, we will give a thrombolytic drug where the clot will get lysed and the patient recovery will be very much there. But there are certain contraindications in giving that the thrombolytic drug, that is tissue plasminogen activator. There are absolute as well as relative contraindications, that is, in these patients you should not give it. This had been a study by the National Institute of Neurological Disorders and Stroke on a TPA trial, that is intravenous tissue plasminogen activator trial. They have conducted and they have come to some conclusion, as these are the absolute contraindications, these are the relative contraindications. Now, the absolute contraindications are greater than 4.5 hours from the time patient was last seen normal. The initial head CT suggests at the time of onset is inaccurate. Suggestion of intracranial hemorrhage on pre-treatment imaging, subarachnoid hemorrhage, intracerebral hemorrhage, intracranial neoplasm or arteriovenous malformation, active internal bleeding, uncontrolled hypertension greater than 185 by 110 mm mercury despite antihypertensive treatment, current bacterial endocarditis, head trauma if there is in the history, intracranial or intraspinal surgery within 3 months, myocardial infarction within 3 months, known bleeding diathesis if there is for the patient, INR of more than 1.7 or a PT of more than 15 seconds, platelet count below 1 lakh, heparin within 48 hours if PTT is elevated, PTT outside of the normal range, dose of non-variant or that is oral anticoagulant within the past 12 hours. Now, these are all the absolute contraindications, and the relative contraindications are minor or rapidly resolving deficit if there is a seizure, a major surgery in the previous 2 weeks, a gastrointestinal or urinary hemorrhage in the previous 3 weeks, a puncture at non-compressible site within 7 days, including a lumbar puncture. Now, these are the contraindications to administering an intravenous thrombolytic drug to lyse the clot that has blocked the vessel, and thereby you had a neurological deficit. This is the result of a trial by the National Institute of Neurological Disorders, NINS trial we call it, on TPA. So, that is it in brief on the contraindications of administering a thrombolytic drug, tissue plasminogen activator, for patients who had a stroke. Thank you very much.